Okay, first, talking about what you're doing here in the Philippines now, what has been the reaction locally to the ship being here?
I have met a number of Philippine physicians and dentists, some pharmacists, a few nurses, and they have been very pleased by this agreement between President Aquino and President Reagan to have a humanitarian training mission. They have uniformly expressed their appreciation and their gratitude, and it's been a very positive response.
What's been the reaction from the people, the potential patients?
The ones that I have seen on board the ship and out at the Medical Civic Action Program site have all been of thankfulness, of gratitude. They too have expressed their appreciation for the fact that this health care is being brought to them.
Has the number of patients been what you expected, more or less? How has that worked?
The number that we're seeing is almost right on the button as to what had been anticipated and planned for. It was our goal to see up to 1,000 patients per day at the clinics ashore. We are exceeding that, perhaps by several hundred numbers a day, so it was very close to what had been planned for.
What medical problems are you dealing with primarily here? Medical and dental, I realize.
At this site, we are seeing large numbers of patients with thyroid disease. We are seeing a number of cases of tuberculosis. And then we're seeing the things that we see back home, the more routine nature, like hernias, skin disorders, ear, nose, and throat problems, a large number of patients with dental problems and caries.
I understand this isn't being done because medical facilities here are not sufficient, but why are you here treating these large numbers of people? Is it a money thing that they can't afford the medical help that's available to them here, or is the medical help not available?
That's a difficult question for me to answer because I've never practiced medicine in this area. Some of these patients are from rural areas, and just as in our own country, the United States, there are some rural areas that are not well served. There are not many doctors and nurses. So I think there are some in that category that we see, and that's probably the largest group.
I was talking to one of the other people, and they said it's a training experience back and forth that the Philippine doctors are learning from you, but because of different medical problems in the Philippines, that the doctors from the States are learning a lot about diseases, illnesses, problems that they don't encounter in the States that much. Can you tell me a little bit about that, please?
Yes, I can. We are seeing a much higher incidence of cleft lip and cleft palate here than we see back in the United States. We're seeing more infectious disease here than we see in the United States. For instance, tuberculosis, which I believe I previously mentioned. There are also other tropical diseases that are indigenous to this part of the world, which many of our physicians and nurses are seeing for the first time. Those of us who are on this mission are taking anti-malarial prophylaxis, something that we do not do when we're back home.
Why are there these problems in the Philippines and not in the United States?
It is partly a matter of climate. We are dealing with much more tropical medicine here than in our own country, of course. And then, too, some of the disease processes that we see are more advanced here. And that, I think, is explained by the fact that some of the rural population do not have the density of doctors and nurses and healthcare officials that are needed to care for the problems at an earlier stage.
Let's switch about what we're talking a little bit. What you're doing here is one thing, but what the ship is really built for is for treating large numbers of patients very rapidly. What in a situation, whether it would be a natural disaster or wartime, talk to me a little bit. What I want are facts and figures about, how big is the staff, how many operations you can do, what you can treat, the volume and the speed at which this facility would operate if it were pushed to the maximum.
You have asked a big question. I will organize my thoughts and try to give you the best answer that I can. The ship is a 1,000-bed, surgically intensive hospital facility. The ship is a 1,000-bed, surgically intensive hospital facility. It is designed to take on board a maximum of 300 admissions per day.